quite relevant scholar in the disaster, in economics of disasters. He's chair in economics of disasters and climate change in the School of Economics and Finance at Victoria University of Wellington. He also was professor at the University of Hawaii, and his main research focus is on the economics to the management of natural hazards, disasters, and climate change. He is a co-founder of a Springer Journal, Economic of Disasters and Climate Change, but he's also member of many other editorial boards of several journals. So I really thank you, Ilan, for being here, for presenting this very interesting talk. And we have, as usual, 45 minutes, 60 minutes of presentation, and then we can discuss and comment the work of Ilan. I think that, as Ilan mentioned before, if there are questions or comments that are relevant during the presentation, you can also raise your hand and make questions and comments. Okay, so thank you, Ilan. The floor is yours. So you have 45 minutes, 60 minutes for presentation.
Okay, you can hear me, yes?
Yeah.
Excellent. Thank you very much, Marco, for inviting me and everyone else for attending. On Zoom, I know that, we are all a bit tired of Zoom over the last, got tired of Zoom over the last year, so I appreciate your attention. This is a joint work with Toshi from Keio University and Eric from University of Bern. I did ask them to join me if they could today, but I think both of them said that they are otherwise occupied. So the smart people are not in the room, but I will try to answer any question I can about this this paper. Just to clarify, this is and you see the picture there is it's titled Self-Portrait with the Spanish Flu. I'm not going to call it the Spanish flu because this is the wrong name to use. Basically, this influenza pandemic in 1918, although it is known as the Spanish flu, had nothing to do with Spain. The reason it is called the Spanish flu, well, there are two stories that suggest why it's called the Spanish flu. One was that they, in Spain, were the first celebrities that were hit by the disease, which is the royal family, the Spanish royal family. So that's how it got sort of named the Spanish flu, because it went around the world that the Spanish royal family got sick. The other reason is that Spain was not part of the First World War, which meant that they didn't have military censorship. In the places where the influenza emerged first, which was France and the US, there was military censorship. So they didn't, the newspapers didn't report about this strange new influenza that was killing people and killing young people in large numbers, especially because it was spreading around the military camps, both in the US and on the Allies, and then the other side on the front, on the Western Front. Anyway, so this is joint work with Toshi and Eric. Now I'm okay. You can see the next slide, yes? Yeah, this is a quote from Robert Barrow, and he said back in sort of mid-2020, he said that he did some work on the Spanish flu, on the 1918 flu, and said that provides, and his justification was it provides a reasonable upper bound for the coronavirus mortality and economic effects. So his argument was, let's look at the 1918 flu, because that will give us a reasonable upper bound for what we're experiencing right now. I think that statement doesn't make any sense. There is no reason whatsoever why this would be an upper bound or a lower bound. It's just a different experience. It's a different pathogen. It actually belongs, it's a different family of viruses. I still think we can learn something from it, but I'm not going to pretend then that this is, closely similar to the COVID-19 experience that we're having in the past what is it, 15, 16 months. So just to make sure that I'm not trying to claim, like Barrow did, that this is actually a direct comparison. When we look at disasters, and this is true for any disaster, and including a pandemic, we typically think about sort of a hazard, in this case, the virus, and that hazard, the virus encounters a population, and that population might be vulnerable or not. We know that in our case, for example, in the coronavirus case, we know that the most vulnerable population are the ones that are very old. In the case of the 1918 influenza, for reasons we don't fully understand, the most vulnerable populations were the young, so sort of 20 to 40, 20 to 45, and the old. So there was this, if you look at mortality rates from the 1918 influenza, it's a sort of a double, sort of a camel hump shape of two peaks, young and old. With the middle-aged, so the young middle-aged, the 50-year-olds, because I'm 51. So the young middle-aged were not very vulnerable to this pathogen. But when you have this interaction of a hazard, exposure, and vulnerability, you end up with some kind of an immediate damage. And that in the case of pandemics, it's measured by mortality and morbidity. In the cases of other disasters, it can manifest itself in asset damages. Of course, not relevant for epidemics. But then that combination of mortality and morbidity and displacement and potentially changing behavior, which is very important in pandemics, results in some indirect losses to the economy. So the economy, typically, economic activity goes down after such an event. Again, pandemic, or it could be, an earthquake like you had in L'Aquila. And that can last for a while, those indirect losses. So the short term here can last, well, depends on the exact circumstances, but we think that for example, in the case of COVID-19, we think it will take a few years for the world economy to recover, and again, depending where and what. Similarly, in the case of the 1918 pandemic. And then in the long term, there is some kind of a loss to well-being that is associated with these events. Another thing I want to mention here already at the start is that we are looking at non-pharmaceutical interventions. So this is in the title of the paper. And the non-pharmaceutical interventions that were used in 1918, social distancing, mask wearing, no large gatherings, and self-quarantining, these are all familiar to us now. So in a sense, not much has changed in terms of non-pharmaceutical interventions in the past century. Now, the question we are asking, is, what were the impacts of these? Well, first of all, what was the impact of the mortality on economic activity in Japan, and specifically on the textile sector, for reasons that I will explain soon? And what was the impact of imposing those non-pharmaceutical interventions, those NPIs, again, social distancing, mask wearing, etc., no large gatherings, what were their impact on the textile sector? Okay. In 1918, NPIs were basically the only tool available for authorities to reduce the infectiousness to what we now know as R0, to reduce the R0 for this pathogen, right? They did have, for example, in Japan, they developed some vaccines. Since they didn't even know the virus, or they didn't even know that this influenza virus existed, we think that those vaccines were not effective at all, but there was a vaccine, and they did inject quite a few people with this vaccine, but we don't think that there was anything useful in it. That's at least the evidence seems to be. At the time, there was no, protocols for testing things and, stage 1 and stage 2 and stage 3 trials and all of that stuff. This is all more came about much after that. But they did have a vaccine, or at least pretended to have a vaccine. So, the NPIs are still the main policy intervention that we have in the first stage, and that's exactly what we implemented, in 2020. But of course, now we have other tools. We have developed both therapeutic drugs to deal with some of the effects of COVID-19, and we have a vaccine. But still, in the first stage of a pandemic, we're still at the same point that people were 100 years ago when they were facing this influenza. In 1918, NPIs were used extensively. They were never as extreme as some of the NPIs that we have seen in the past year in many countries. So this is true in NPIs in Japan. It's true in NPIs in other places. For example, many, very, very few countries closed their borders completely to newcomers, like we did, New Zealand did in this case, right? So our borders have been closed for a year now, and nobody is allowed in other than citizens. But this was never really implemented during the 1918, but they did implement a lot of NPIs. Okay. There is another thing to remember when we're talking about NPIs in the context of Japan. There's a lot of evidence, and I'm sure you sort of know of some sort of circumstantial stories about the fact that in Japan, even if you declare something that is a sort of voluntary suggestion from the authorities, most people follow it. So unlike in the US, where the government says, put a mask on, and people, to spite the government, don't put a mask on, in Japan, if the government suggests something as a voluntary measure, typically the take-up rate is very, very high. And there's research that shows that during COVID-19. So our assumption here, since the NPIs in Japan in the 1918 pandemic, influenza pandemic, were voluntary. So this is the government telling the public what they ought to do, what they should be doing. Our assumption is that people were following those things. Because maybe in other cultures, if you have these voluntary NPIs, you can assume that they're ineffective because nobody will follow them. I'm originally from Israel, and I can definitely tell you that the voluntary measures that were attempted in Israel in the past year were completely ineffective. Even some of the mandatory measures were ineffective because people ignored them. In Japan, I think the picture is very different, and therefore we think that the NPIs in 1918 were followed, were adhered to, and there is some circumstantial evidence to support that from newspapers and so on. Sorry. Okay. So we are focusing on NPIs. NPIs can have an impact in two ways. They can affect the exposure. So for example, social distancing can reduce the exposure and therefore reduce the R0, the infectiousness of the disease, and therefore reduce mortality and morbidity, and therefore reduce the economic impact of the pandemic. Or NPIs can have direct impact on the economic activity because of social distancing, because people have to stay home, because people cannot interact in various ways. Economic activity goes down. Okay, so we need to differentiate between those two ways in which NPIs might have an impact on the economic impact of the pandemic. This is true for any pandemic. Okay, our focus here is on this measure. Okay, by controlling for the mortality, we are only focusing on whether NPIs directly had any impact on economic activity rather than whether they had an impact on mortality. Okay, there are two reasons for that. First, we can differentiate between the two, so that is a useful one. And second of all, there has been research, not in Japan but in other countries, on what is the impact of, especially in the US, what is the impact of NPIs on mortality and morbidity from pandemics. Curiously enough, the early research on this said that NPIs are completely ineffective. And they don't reduce mortality and morbidity. That was the accepted wisdom in much of the public health community, which is why the World Health Organization, at least initially last year, said that there is no much point in wearing masks and no much point in social distancing, and they suggested that borders shouldn't be closed. They changed their view around March and April when the evidence seemed to suggest otherwise. But that was the accepted wisdom, although there was some research coming from the US that looked at the 1918 pandemic. It showed actually that NPIs were, the NPIs that were implemented in some cities in the US were actually useful in reducing mortality from the 1918 event. But in any case, we're focusing on the NPIs, that the direct impact of NPIs on economic activity. Okay, so what do we know about the 1918 pandemic from an economic perspective? Surprisingly, the literature on the pandemic, the economic literature on the pandemic, is quite small. This slide basically covers everything that was published up to the last maybe 6 months on this pandemic, on the 1918 pandemic, in the economic literature. This is surprising because, you know, we need to remember that the 1918 pandemic was, you know, potentially it was the highest, it was probably the highest mortality event of the 20th century. Okay, it killed many more people than the First World War. We don't know exactly how many people it killed, but sort of reliable estimates are probably between 30 and 50 million, which means that it killed as many people as the Second World War. So it was a very, very, very dramatic event. But in spite of that, there's been very little economic research on it. Now, if we look at the economic research on it, there is one literature that is quite prominent, and that started with Doug Almond in 2006, of what we call the fetal origins hypothesis. So basically, the argument there is that exposure to shocks in utero may have long-term impacts on the development of the babies and eventually the adults that emerge from that. So what Almond does is look at people who were born just after the pandemic, so people who were in utero during the pandemic, and he shows long-term, using census data from the US, that some adverse outcomes to those people. Okay, this is a debated point because there's some other papers that show that actually his results are not very robust. Specifically, Brown and Thomas argue that. But there's been, since the Almond paper in 2006, there's been a bunch of papers that have looked at similar questions in other countries, so in Taiwan, in Brazil, in Japan, again, using census data and looking at people who were born just after the pandemic, so they were in utero in the pandemic. And in Taiwan and Brazil and Japan, basically the results confirm what Almond has found for the US. Cook et al. Follow that and actually show that this adverse shock basically passes on to the next generation. Of course, it doesn't pass on because the people are still infected with the virus, but rather because people who were in utero during the pandemic have less education and have lower salaries and lower lifetime income, their children are also suffering. They're not suffering from the pandemic, but they're suffering from the fact that their parents are less educated and have less income. So this shock is transmitted into the next generation. This is not very different from what was found in for other shocks. So there are some nice papers on, for example, some earthquakes where they show that the shock gets transmitted to the next generation. Okay, so that's one literature. That's by far the most prominent literature on the 1918 pandemic. There is a little bit of a macroeconomic literature for which, which is much more similar to what we are doing. There is the Barrow et al. Paper that I already quoted from, and this one does a cross-country growth regressions where they have, on the right-hand side, they have the mortality rate from the pandemic, from the 1918 pandemic, and they look at growth rates, and they find an adverse impact of death from the mortality from the pandemic on growth rates. And then there is a few papers that looked at very local. They collect some data on local economic activity, maybe something about the operations of the manufacturing facilities that are present, or something like that. And then in different districts in Sao Paulo, and then they correlate that with mortality from the pandemic and conclude something about the impact of mortality from the pandemic on economic activity in these very small areas. So that would be municipalities in Denmark or cities in the southern US and so on. So there's several papers like that. Actually, maybe the 4 papers, I'm aware of the 4 papers that are cited in our paper. So one on Brazil, one on Denmark, one on the US, and one on Sweden. And then there is a Correa et al. Paper that looks, this is by far the most similar paper to what we do. And they look at NPIs and economic activity in the US using the census of manufacturing. They have data that is only every second year, so biannual data. So they're looking at a bit further, I think it was economic activity in 1921 and 1923, as it correlates with mortality at the depth of the pandemic, which was 1918, 1919 in the US. We do something similar. Well, I'll get to what we do, but we focus on a specific sector, and we have slightly different approach, empirical approach to what they do. Their results are actually contested, and there's some papers that say that their results are not robust, and there's a whole sort of very robust discussion about that between various researchers that have looked at the US data. Okay, on Japan, the main researcher that has looked at the impact of the pandemic, this is Hayami, who published a bunch of papers in Japanese. I, of course, don't read Japanese. Well, not of course, but I don't read Japanese, but I do. One of the co-authors on this paper does. Hayami is not a statistical applied research, economic researcher. So it's mostly descriptive and mostly relies on archival newspaper accounts, but it's a very comprehensive, from what I'm told, comprehensive set of evidence on what happened in Japan during the 1918 pandemic. We argue that Japan is a developing country in this stage. So manufacturing is becoming very important. It's urbanizing. There is, clearly urban agglomeration happening. So these, Tokyo is emerging, Osaka, and a few other urban sort of agglomerations are emerging as focus for manufacturing activity. And a lot of that manufacturing is textile. So very similar to a lot of other developing countries that have gone through the process of development. Textiles is typically the first sector that they start with, right? So this is the process that maybe, I don't know, Bangladesh and Vietnam are undergoing now. Vietnam maybe has already passed it, but clearly, typically development starts in textiles. As in other countries, those textile factories are employing young rural women. So we've seen the same pattern in a lot of other countries. Once you start getting manufacturing, and it usually starts with textile, and you employ young unmarried rural women. So it's not very different in Japan. The factories are in the cities, but it is mostly, the workers are mostly young rural women who come and live in dormitories in the cities. Those dormitories become very important, of course, when you have a pandemic. One more note, public health was the responsibility of the police. And what's important from our perspective, it was not nationally determined, but rather locally at the prefecture level. So that allows for different public health measures in different prefectures, which is, you know, this allows us to identify better what is going on in terms of the NPIs. This just shows you the prefecture. So our data is prefecture level. There are 47 prefectures in Japan at the time. And we have annual data for the textile sector. So what we know about the textile sector is the number of employees, the value of the textile output in yen. This data, we basically link together two data sets. The Census of Agriculture and Commerce and the Census of Manufacturing. They have a slightly different rules around what is included in the data set. But luckily for us, there were 2 years in which both data sets are available, so we can compare them. And we show that the correlation is 0.93, if I remember correctly. So it's very high correlation between them. So we can reliably link the two, okay? So we are linking those two data sets, but basically what we're analyzing is the number of employees and the value of the textile output, okay? That's our explanatory variable. Now, the pandemic in Japan, it starts in September 1918. This is significantly after the pandemic emerges elsewhere. So, you know, Japan is still it's an island country, and it takes longer for these things to get to it. The first cases globally emerged, I think, around March 1918. Where exactly there is disagreement, but I think that the most likely hypothesis that it starts in Kansas, in the US. There is another possibility that it starts comes from China, with Chinese workers who are working for the Allies in the Western Front. But there's the evidence on the US emergence is probably stronger. In any case, it actually gets first to Taiwan, which is at the time a Japanese colony, to a bunch of sumo wrestlers for some obscure reason. So the first at least reported cases were those sumo wrestlers in Taiwan, but the first reported case in Japan, and we only use Japanese data, so we don't look at the Japanese colonies in Korea and Taiwan at the time, although that data does exist. The first reported case is in September 1918, and then we have a first wave that peaks in October and November 1918. So basically the winter of 1918, the end of 1918, and then a second wave that is at the end of 1919 and to early 2020. Okay. The first and second waves are somewhat different in different places. So sometimes, for example, in the US, they are talking about the first wave back in March, April. Then the second wave correlates with the first wave in Japan. But in any case, for our purposes, we have two waves, and I will show you the data this is the data. So, and you can clearly see the wave. So what are we seeing here? We're looking at excess deaths. Now this is important, and I'm sure you have heard discussion of excess deaths in the last year, it's hard not to read anything about the pandemic, the current pandemic, and not hear something about excess deaths. You may have seen maybe the last issue of the Economist magazine, who tabulated excess deaths globally, and they concluded that the mortality from COVID-19 is maybe 3 or 4 times higher than the official death count. So the official death count is above 3 million, but they concluded the actual death count is above 7 million, and potentially even maybe 15 million. And they do that by looking at excess deaths. So the idea of excess deaths is, well, we don't have a good toll of who is exactly dies because of the pathogen. So what we do is looking at compare mortality from previous years to the year of the pandemic, and if mortality is higher during the pandemic, overall mortality is higher during the pandemic, we conclude that it is because of the pandemic. That's the idea of excess deaths. Now we have sort of we take a hybrid approach to this question. The problem for us is if you look at excess, you just look at excess deaths. So you just look at the rate of mortality, say 1919 versus in the previous couple of years. What you end up with, you are also counting deaths that are indirectly caused by the pandemic. And what we are interested in is actually identifying the impact of the pandemic itself on economic activity. So for example, we know that suicide rates change during pandemics, but this is not what we are trying to capture. We want to capture directly the disease impact. So we are not looking at overall excess deaths, but rather the Japanese have reported death counts by cause of death. So we take 6 causes of death that are respiratory. The argument here, one of them is influenza, but there are others, bronchitis and TB. And we argue that it's likely that respiratory deaths might have been misdiagnosed. So because people were not familiar with this influenza, for example, while they were familiar with influenza, they didn't expect influenza to hit young people. So maybe they have associated the disease with bronchitis or TB. So we take the 6 respiratory causes of deaths and the 2 that are ill-defined. One of them is an ill-defined cause and one is unknown. So we take all these deaths together and we calculate the excess deaths for them, not for the overall mortality rate. Okay. What you see in the graph there is exactly that. So basically you develop a model that predicts mortality based on data from before the pandemic. That's what's the seasonal line there. Sorry, but I don't know which colors they are because I'm colorblind. But then you see the actual death, and you clearly see spikes at the end of 1918 and at the end of 1919. Okay, there's obviously 2 spikes in the data, and that's the mortality from the pandemic. Okay, in our estimations, we actually calculate the excess deaths for each prefecture separately. So in the paper, which I'm not sure if we shared, but if we haven't shared, I'm happy to share the paper. Then we have graphs that show the excess mortality for each prefecture. And actually, interestingly, there's a lot of variation. So some prefectures didn't really have a very big first wave, but the second wave was very big. Some had, most had bigger waves in the first wave. And you can see that from the overall data, that the first wave was bigger than the second wave. That's true in Japan. It's not true everywhere. So in some other countries, the second wave was actually much bigger. But in some prefectures in Japan, that was the case as well. So each prefecture had its own pattern. Some had very little first waves and big spikes in the second wave and so on. But we can calculate that, and we have. In terms of notification policies, you can see the picture there is, basically don't cough on your kids. I'm sure that people have told you that during the last year as well. Coughing on your kids is not advisable. But basically standard notification policies that we would expect today. And there are standard sort of NPIs that we have seen today. These notifications about those policies started in sort of the tail end of the first wave. So the first wave, people were still trying to understand what was going on, and it took the government a while to start issuing these what we call notification policies about what is the advisable behavior, like don't cough on your kids. And there is variation. Again, there is variation across prefectures. We also distinguish between two methods of notification. One looks at media, so newspaper ads in the newspapers, billboards, and during the newsreels that come before people were when they were going to the cinema. Then you had these newsreels, and these newsreels would have also advice about how to deal with the pandemic. So these are the media notifications, and then there was sort of more direct notifications to households through letters that people were sent. So basically, these brochures that people were delivered to houses. To be honest, we don't really see much difference between the two. So that distinction might be interesting for somebody who works on communication, but didn't really seem to have a different kind of impact associated with it in our case. Okay, so that's the two types of notifications. And basically, because the list of types of things that they were recommending was pretty standard, we're just looking at a binary indicator whether they made those notifications at the prefecture level or not. And again, whether it was done directly through official correspondence or via the media. Okay, I should say that masks were probably, introduced in the pandemic. So the first time that masks are beginning to be widely worn to deal with respiratory diseases, infectious diseases, is during this pandemic. And actually in Japan, they took hold, and people have continued using them ever since. Okay, this is just the data. So we have excess mortality. We also separately have excess female and male mortality because the data allows us to do that. That it's not very different. I should add that the excess mortality for females is slightly higher than males. So slightly more women died because of the pandemic in Japan than men. And I'm actually not sure if that's the case elsewhere in other countries, but that's at least the case in Japan. For us, it's important because you remember that a lot of the workers in these textiles factories are women. Okay, yeah, that's the statistics. So what are we estimating? Well, we are estimating a spatial model. Why are we estimating a spatial model? Because there is some migration from nearby prefectures. Japan is not a very big country, so prefectures are pretty small, so there is crossing of prefecture boundaries for people who live in one rural area and then go to a city in potentially an adjacent prefecture to work. So we are interested in those linkages. So we are estimating a spatial model. Okay. I should also mention that there were already a pretty extensive network of railways during this time. So this assumption that there were some connections across prefectures seems to be borne by the fact that there was quite a lot of quite an extensive network of railways at the time. I wish we had passenger information on the railways during that time, but we regrettably don't. That would have been very useful. But we tests whether we should be using a spatial model showed consistently that the spatial component is important. So we do estimate a sort of a full-blown spatial model where it's both the dependent variable is affected spatially, as well as the control variables, as well as the error term. So it's a full-blown spatial model. Okay, so our estimates are basically, on the left-hand side is either output or employment in the textile sector. And you see the total impact of excess mortality and on output and employment in the textile sector. And then, we distinguish between the direct and the indirect impact of this excess mortality using this, the spatial model. Okay, so what we consistently see, and this is maybe not very surprising, that mortality affects output and employment. So the higher the mortality from the pandemic, the lower would be output and employment. The impact is slightly higher, at least for output, in case of female mortality. None of this is statistically different. So the difference between column 1 and 2 and column 3 and 4 is not very large. Column 1 and 3 is total mortality, and column 2 and 4 is female mortality. But the differences are not very large between them. But we consistently observe a very robust result is excess mortality causes adverse economic consequences. Maybe not terribly surprising, but noteworthy. In terms of total and once we include the NPIs, we observe that the NPIs seem to ameliorate the impact of excess mortality. So ME should be EM, excess mortality, and I apologize for this typo. I thought we fixed it, but we fixed it in the paper and not in the presentation. But consistently, what we observe is once you have issued NPIs, then that seems to be very effective in ameliorating the impact of the excess mortality on economic activity. So, and if you look, overall you look at the impact of the pandemic, it is still adverse, but if you add those two coefficients up, but it's much smaller. Okay, so if you issued these notification policies, your mortality from your economic impact, both on output and employment in the textile sector, is significantly lower. Here we're trying to distinguish between the distribution channels for these NPIs. We don't observe that much. So once you do that, you lose the economic significance, and you also lose these distinctions. So we think that we might be either there isn't a difference. So once you issued those notification policies, it's basically reached everyone. So it doesn't really matter which one you chose. That's probably the most likely explanation why the difference doesn't matter. But we're not sure. Okay, what have we learned? in the case of Japan, mortality from this pandemic, from the 1918 pandemic, is associated with a very significant decline in textile employment and output. Okay. And what we also find is that non-pharmaceutical interventions were very effective in reducing this impact, or this adverse impact on economic activity. So once you have NPIs in place, the adverse impact on economic activity is significantly lower. Some evidence that distinguishes between the public information campaigns, that the media ones were a bit more effective, but this is not very convincing. So I'm not really want to push that point through. It's not a very robust observation. Yes, in some of the regressions this comes out, but in others it doesn't. So I don't think this is a very robust observation. What else can we do? Okay. So ideally, we would like to have better coding of the NPIs and potentially distinguish between different kinds of NPI. But again, the variation across prefectures is not very large. So potentially, if we had a global data sets on NPIs that were implemented during the pandemic, maybe there's a bigger variation there. And maybe we could, observe something about, I don't know, mask wearing was not as effective as canceling large gatherings. Okay. In a sense, we can do that analysis if we had the data for the Japanese, for the 1918 influenza, not so much for the current COVID-19, because for COVID-19, there was much more uniformity across the globe in terms of what are the advisable, what policies were pursued by government. There is some distinctions, but generally speaking, in some cases it was mandatory, in some cases it was voluntary. So Sweden is well known to be sort of where the government didn't choose much mandatory impact, non-pharmaceutical interventions, but rather a lot of advice and voluntary requests to do certain things. But we know that people did them, so that distinction is not very interesting. In the case of the 1918 pandemic, there was a lot of variation, right? So in some places around the world, people organized large religious gatherings to pray to reduce the impact of the pandemic. Clearly, something that was, well, not clearly, but probably something that was counterproductive. The second question we would like to ask, but what we can't really, at this point with the kind of evidence we have, is why were these NPIs effective? So what specifically about the textile sector and the way they operated in Japan led people to be, to change their behavior? So what exactly changed in the textile sector for those NPIs to be effective? There's no evidence on that, so we don't really know. So the newspapers are pretty silent on this, and we don't have a lot of other eyewitness accounts and so on, so we don't really know. Maybe from some other jurisdictions, maybe in Italy, I don't know. There is better evidence. What happened to other sectors? So textile is by far the biggest sector in Japan at the time, so we don't think that the other sector, the data is reliable enough. They're just too small. But again, potentially in other countries, one can distinguish between those sectors that are very labor intensive and specifically rely on these workers who are living in dormitories versus other sectors that are maybe less labor intensive, machinery, for example. We don't have good evidence on that at the moment. And of course, are the results on Japan at all relevant to other countries? There's very little research on other countries. As I said, I basically told you all the research there is, and therefore, I think that still needs to be looked at. There's a lot of indirect economic impacts that we would like to think about. So what happened to global prices and what happened to trade? What that meant going forward, and how sort of those secondary and third degree impacts, how long they lasted, we don't really have good evidence on that because the data is pretty scarce on this at this time. So that's basically where we would like to go next. I do want to end with, you know, a picture that I think is, first of all, it's interesting. And second of all, I just want to emphasize that, you know, the reason we wanted to look at the 1918 pandemic is the fact that we felt that we were caught off guard by the COVID-19. So we were, in the case of COVID-19, the economic profession in general, and we specifically as the, you know, the three people who worked on this paper, were like this penguin. We were, you know, facing something we didn't really expect, but that we should have expected. Okay, the infectious disease literature is full of predictions about a coronavirus that emerges out of probably a bat population in Southwest China, and turns out to be, you know, transmissible between humans and potentially deadly. Okay, there's plenty of predictions on that. Since the SARS epidemic from 2003 and even before that. So we knew a coronavirus is waiting in the wings. Still, the economic profession was completely surprised, and I was as well. Not so much by the fact that, you know, a coronavirus emerged, but the economic dislocation that is associated with this. I was part of discussions back in the end of 2019 here in New Zealand on what kind of scenarios would cause, what kind of pandemic scenarios would cause New Zealand to close its borders. And the people who were discussing that, we all thought that this was a pretty far-fetched idea and that it has to be, you know, something very drastic will have to happen so that New Zealand closed its borders. And, you know, 3 months later, New Zealand closed its borders because of a pandemic that was already starting to emerge when we were having those discussions, which we thought were mostly sort of academic interest rather than practical relevance. So I think since 1918 is the nearest event to us in terms of its size, then I think we should be learning something from it, even if I don't support Barrow's predictions. I think that's it. And I'm happy to take questions. I have no idea how long it took. Oh, I took an hour.
No, you were perfectly on time.
Yes.
So thanks a lot, Ilan. Very nice presentation. So are there any questions from the audience? So any students who would like to open the discussion? Any questions, comments? Okay, there is one question from Chiara Lodi. Chiara is a postdoc at the University of Urbino, so she is young enough for starting the question.
Good morning to everybody. Sorry for the mask, but I think it's necessary in the office with other people in terms of NPIs, I know. So very quick question about your presentation, very interesting and very fascinating from the pandemic impact, as also Marco knows. My question is about one of your possible further research. It's about the validity of your result in other countries. I think that could be possible difference because all we know is that in Japan, there is a high attendance of rules. So we all know that they adopt every day mask and other stuff like that, because also if there is not a pandemic, in order to respect the other. And we also know that if there are rules, they follow them, and without acceptance. So I think that possible difference on results could exist in other countries in terms of cultures, maybe, or in these terms. So could be very interesting to know that. And the second one is also maybe a suggestion or an interesting question, I don't know. We know that the Spanish pandemic ends in 2 years, maybe less or more or less. But we are at the beginning of the 19th century. So things are completely different from now. Things go more slower than now. The connection is less slower than now. And so I think that could be interesting to compare the after pandemic of the Spanish pandemic in 1918 and after the coronavirus, because it's also interesting to understand which is the weight of the result in these two completely different periods, I think so. I don't know, maybe result and effect are more higher in that period instead of now, but I don't know. It could be interesting to understand also this. Only, and thank you so much for your presentation, Ilan.
Yeah.
May I add something that is very related to the questions of Chiara? Because I was thinking a similar thing about, my question is that, do you have data about the first reported cases by prefecture, by Japanese prefecture? Because I was thinking about the transmission, the difference in the transmission of the how to say, the virus in the countries. Today is very fast, like it's global transmission. So since the first reported cases in China, then worldwide the sprawl of the pandemic was quite fast. So I would like I would like to know if there are differences in the timing of the first reported cases, prefecture by prefecture in Japan. In these cases, you could also have the feeling of the perception how fast the transmission is.
Yeah. Yeah. Thank you for these questions. Starts with the sort of the pandemic itself rather than its economic impacts. We don't have data we don't have detailed data in Japan. There is data on mortality from the pandemic, which is data we don't use. We use the excess deaths because the mortality from the pandemic, Hayami, who is the sort of the person who looked at this most closely, says that it's vastly underestimated. So people didn't know what this thing is. A lot of the symptoms are very similar to other kind of respiratory illnesses. So there is no good diagnosis, and because of that, we don't, and it spread pretty, once it gets to Japan, it spread pretty quickly. So like most influenza viruses, it's incredibly infectious, right? It's much more infectious than the COVID-19. So it spread pretty quickly once it gets to Japan. It takes it 6 months to get to Japan. So it's clearly slower. Global spread of this is definitely slower than COVID-19, but very, very few places managed to escape from this one. So from the 1918 influenza. Actually, the only place I know that had no cases was American Samoa. So Samoa had this sort of a tragic story. Samoa is divided into 2 countries at the time, or 2 jurisdictions. One is a colony of the United States, and the other one, regrettably, is a colony of New Zealand at the time. The New Zealanders allow ships to dock in New Zealand, Samoa, and one of those ships from New Zealand brings the pandemic, and it's devastating for an island country that's not really exposed to regular influenza. It's devastating, and the estimates are that about a fifth of the population dies. While in American Samoa, the American governor says no ship can dock for the duration. So for 2 years, no ship docks in American Samoa, and they just escape this without any consequence. So but the point of this story is not how horrific the New Zealand authorities were, which they were, but rather the fact that it spread everywhere. So even though it spreads slower, it spreads everywhere, and it spreads to every prefecture in Japan, and it spreads to every country in the world. But we don't really have very good data. So if you read the literature that tries to sort of map out the transmission of the 1918 influenza, it relies on very sort of circumstantial evidence, newspapers, articles, and stuff like that. We don't have good systematic data. On the economic effects, up to recently, this was not widely known that there was a big shock, economic shock associated with the 1918 influenza. So if you look at literature written maybe 15 years ago, sort of economic history, they ignore the influenza as an economic event, which is surprising. This kills 50 million people. But that's generally true about historians, and so it's not only economists, it's the world has been so traumatized by the First World War and then the influenza that they didn't want to talk about it. So we don't really have a good sort of global idea of what was the economic impact of the 1918 influenza. It's hard to believe that it wasn't very large, but we don't really know. So if we want to compare it against the impact of COVID-19, which was clearly a humongous economic shock, we can't really, because we don't have the data to do it. And this paper is one of very few papers that tries to put some numbers but this is a very specific to a specific country and a specific sector. There isn't any kind of good quantification of that. My guess is that the COVID-19 was a bigger economic shock than the 1918 influenza, but that's a guess. It's not a very good guess, I would say. It's not based on that much evidence. It's really difficult, and I didn't say that, but we chose Japan for another reason, except the fact that the Japanese have very good data, and they collected already very good data. So this is a developing country at the time that collects very good data. That's very unusual, right? But the other reason we focused on Japan is that Japan is not part of the First World War. So if you look at countries that were part of the First World War, it's very difficult to distinguish between, what happens when you emerge from the war and then you're hit by these things. So there are these two conflicting sort of powers that have an impact on the economy at the same time, and it's very difficult to distinguish between them. And that's why we focus on Japan, because Japan was not part of, or it had a very, very, very minor part in the First World War. So they are not experiencing this post-war, all the soldiers are coming back home and they are unemployed and all the economic dislocation that is associated with the end of the war, which was very traumatic in many countries. Yeah.
Okay, thank you. Other questions or comments? There is Carlo Caporali. Carlo is one of our PhD students. So, Carlo, if you have a question,
Yes,
you can...
thank you.
Thank you.
Good morning and good evening to you, and thank you for the interesting presentation. I enjoyed it a lot, and I hope my question is not stupid in a way that, because I was wondering whether it would be possible to account for the role of bureaucracy, in the sense that, thinking of Japan, I was just this morning hearing at the news that Japan is now paying this slowness of the bureaucratic system, and up to the point that nowadays apparently they have only Pfizer vaccine authorized. And so I don't know, for historical analysis as the one you presented, but whether there would be, you know, a way or a measure for bureaucratic processes in this emergency phase to analyze also the consequences in a comparative view between countries. Thank you.
Yeah. So first of all, I'm not a Japanese specialist, and that's why I would have liked Toshi to be part of this, because he's the, you know, the Japanese historian who worked on this paper, and he would know a lot more about that question. So the extent of sort of bureaucratic, you know, status quo, preference for the status quo, and sort of reluctance to move further. We did see that NPIs were only starting to be implemented in January 1918, right? The first case is in September 1919. The first case is in September, right? So it takes them 5 months to actually start issuing instructions about what to do. And instructions to the people, instructions also, I didn't mention that was specific instructions issued for textile factory owners, advising them on how to sort of keep social distancing in textile factories and things like that. So it takes a while. Whether Japanese, you know, are more bureaucratic than other countries and slower moving, I don't know. There will be years of research looking at the past 12 months and how different governments reacted to this shock. And we see quite a variation, I think, with a lot of surprises, right? So if, you know, actually there was a ranking of which are the countries that are most prepared for a pandemic. This was a ranking that was done, I think, in 2018 or 2019. The top of the list is the US, right? The most prepared country in the world for pandemics. And we see that they completely bungled the first year, okay? But then they were very successful in the vaccine stage. There's similar Israel is the prime example of that, completely bungling up the first stage and then successful with the vaccine. So I think that the point I'm saying that is the standard views that we have on, you know, cross-country comparison in terms of effectiveness of government, you know, how agile and quick the government is, doesn't seem to hold that much for this, you know, the kind of shocks that we are thinking about in terms of pandemics. Some countries, I think, in the current situation, some countries where you would have thought would not be very effective, mine included here in New Zealand, were incredibly effective. Okay, the government here is not known to be the most effective in the world. If anything, it's known to be very cautious and moderate. But it was incredibly aggressive, and because of that, you know, we had I think Chiara was wearing a mask. I haven't worn a mask in public in the last year because we don't have COVID-19 here. But that's not something I would expected, you know, a year and a half ago. So I'm a bit sort of pushing back against this idea of, okay, we can characterize the Japanese government in a certain way, and then what can we learn from that? Because I think it's more complicated than that. Yeah, I don't know if this answered your question, but that's
Sure,
at least.
sure. Thank you very much.
Okay, thank you. Other questions from the audience? Otherwise, I have some questions too, or some curiosity. Okay, I can take the floor for a while for my questions, and then if someone has questions, can raise his hands and raise questions or comments. Okay, my first point is about thinking about the 1918 pandemic and the relation with what is going on during the COVID pandemic. My idea about the economic impact of the COVID pandemic is quite clear, even for the actions that has been put by the governments, like lockdowns, wearing the mask, and so on. So in some sense, there is a sort of reductions in the demand because people are at home. We have seen a lot of reduction, especially in the services sectors and so on. But it's not totally clear to me which are the channels of the transmission of the economic impacts of the influenza pandemic, because there was no lockdown at the time, if I'm not wrong. Maybe I'm wrong, but there was just issue with the NPI that you mentioned. But in this sense, I don't know why, for instance, the manufacturing sectors experimented a sort of reductions in the demand. So this is probably the tricky part for me in trying to defining what was going on at that time. So I don't know if you have some clues about that.
Yeah. So we do have, for example, newspaper reports in Japan of news about cases of influenza in a specific factory, and then reports about the fact that the workers are fleeing, are basically going back home to the rural family, to their parents, because they are afraid of this thing that is spreading in their factory. And in some cases, we actually have newspaper reports about factory owners trying to prohibit the workers from leaving. And the workers, this is young women mostly, going to the police and asking the police to tell the factory owners that they can't keep them there, that they want to leave. And we also have newspaper reports about parents coming to the city to get their girls back to their home in the countryside because they are afraid of this pandemic. So we have the mortality, which is significant, reducing economic activity, and also this idea of, and we have reports of shortages of workers in the textile sector as a result of the pandemic. Okay, so that's the main channel, I think, through which you have an adverse economic impact. What we do find is where government, the local governments do these NPIs, then that seems to be ameliorated somewhat. So maybe once the government issues these advice, but this is maybe, I don't have any evidence for that. Maybe people are less fearful of that. And therefore they are more willing to go to work, for example, right? So again, unlike our sort of premise was NPIs would decrease economic activity, but this is not the case in Japan. Okay, there's a consistently positive coefficient associated with these NPIs. And we think that it's probably because then it doesn't look as scary and you think that everything is under control because, my factory owner now keeps social distancing, everyone is wearing masks and so on, then there is less fear. And because of that, less decline in economic activity. Ultimately in pandemics, and this is true in every pandemic, the main economic impact is not the direct mortality and morbidity. It's the fact that millions and millions, and this, in our case now, billions of other people change their behavior because of the fear. Justified or unjustified, I don't know, depending on the circumstances. For SARS, for example, we know the SARS epidemic in 2003, we know that air travel globally crashed because of SARS, although there were only 6,000 cases worldwide. So clearly, sort of, and I at the time I was living in Hawaii, tourism sector in Hawaii crashed completely. So tourism stopped because of SARS in 2003 for no reason, because but that most of the tourists in Japan in Hawaii were Japanese. Japanese stopped going to Hawaii because of SARS in China. Didn't make any sense, but that's the case. And that's the point. So we need to think about not the direct impact of the pandemic, but rather how are people perceiving the pandemic as a result of these interventions. And I think that's why potentially these NPIs were effective. And whether that's the case here, currently, I don't know. That's an interesting question.
Okay, thanks a lot. Yeah, I had the same feeling about the perception, and sometimes there is also, to me, it's also tricky sometimes understand how some disasters are relevant in the how to say, in the audience or in the perception of the people, and other disasters are not. Like influenza pandemic was not that relevant before probably COVID-19. So there is this sort of switch that is made by a sort of psychological effects of the perception of a disaster. So this is something that
this idea of perception and how perception is incredibly important emerged. If you look at other disasters, other types of disasters, you see evidence of that as well, I think. So just to give you two examples, after the 1906 San Francisco earthquake, the Chamber of Commerce in San Francisco decides, let's not call it an earthquake, let's call it a fire, because after the earthquake there was a big fire in the city. Now fires were a known risk, so let's call it this 1906 San Francisco fire, and therefore people will not be afraid of something they didn't understand yet, which is earthquakes, right? Earthquakes, we developed the knowledge about earthquakes only in the mid-20th century, so way after the San Francisco earthquake. So people understand intuitively already that perceptions are everything in terms of economic activity. So if you don't want to have economic activity decline, you need to deal with the fear. And so that's already, we have evidence of that even before the 1918 pandemic. With influenza, there was a lot of, the 2009, 2010 influenza pandemic, the H1N1 that circulated the globe, and a lot of people feared it a lot. So there was a lot of discussion at the time in 2009 that this can turn out to be a repetition of the 1918 pandemic. And that actually resulted in the first resurgence of interest in the 1918 pandemic, this H1N1 pandemic, which turned, they also called it swine flu, because it manifested it came out of pigs. That turned out to be a non-event. Not a non-event, it turned out to be a pretty serious influenza year, but not much more than that. And that might explain some of the slowness in reaction to the COVID-19 in some places, if anything, right? In contrast with countries that experienced SARS in 2003, which were by far faster in reacting to the COVID-19 pandemic. So historical experience is incredibly important in shaping the perceptions of what this is, especially at the first stages.
Yeah, sure. Okay, thanks a lot. There is a question from Fabiano Compagnucci. Fabiano is assistant professor at the GSSI. Okay, Fabiano.
Thank you, Marco. Hi, Ilan. Thank you very much for your very interesting and timely presentation. I have a curiosity. I was trying to picture the difference between the current pandemic and the Spagnola pandemic. And I was thinking that nowadays, the country which were severely, more severely hit by the pandemic were those countries whose economy is importantly touristic and leisure based. For instance, Spain, France, and Italy, they had a lot of damages from the pandemic. And I was wondering if it is possible in the, according to your knowledge, if there are some data available in order to understand which were the countries which in the 20s were more touristic oriented. I mean, I remember that Paris was well known at the beginning of the last century because of the Les Années Folles, we can say. So it's just after the First World, there was a period in which people wanted to have fun, after maybe also after the Spagnola. So if I don't know if it is possible to I can say to picture a different economic structural change with the historical data in order to understand which were the country more I can say affected by the Spagnola.
Yeah, well, data is not for cross-country comparison. I think data is not available, and you're right that, and you know, to sort of continue with what I was responding to Marco, the impact of a pandemic is not the mortality and the morbidity, but has to do with perception and the structure of the economy, right? So tourist economies have been affected much more drastically. And actually in sort of my neighborhood, we have a few South Pacific islands which are very reliant on tourism and had no COVID-19 at all. Samoa and Tonga and Vanuatu had no COVID-19, have no COVID-19, not a single case, but their economy is devastated by the global collapse of tourism, right? So it's that disconnected that you can have no COVID-19 and suffer very significant economic consequences. In terms of 1918, 1920, tourism is not a big sector globally, right? So there is no significant global tourism sector at all. I think it only starts, tourism as a sector that actually gets measured separately only starts to emerge probably in the 1960s, when you start having commercial flights and people start moving around the world. But even then, it's a pretty small sector. So it only really emerges as a very big sector probably in the 70s and 80s. But there are potentially other sectors that are much more vulnerable than others. And that's exactly why we focus on textiles, because we think this is one of the more vulnerable sectors, because it's very labor intensive, because it's very crowded typically, it's hot. And sort of they have to maintain humidity within the facility so that the fiber doesn't tear. So these are all conducive to the spread of this thing. And people are living in dormitories. So this kind of structure that you have in Japan, where it's young women from the countryside who live in dormitories and then work in textile factories, that's common in textile industries globally. So we think sort of textiles was the tourism, in a sense, the tourism sector of 1918, in the sense that was the most vulnerable sector, which is why we chose to focus on it. We don't have good cross-country data that allows us to say, you know, much more than that.
Thank you, Ilan.
Okay, thank you, Fabiano. Now there is another question from Ugo Rossi, that is associate professor at the GSSI.
Hello, thanks for your very interesting talk. I would like to ask you, what is I've recently seen, just in the last few days, the cover page of The Economies, the British weekly magazine, saying that now we are expecting a major post-pandemic economic boom. And I guess if there is a relationship between the so-called Spanish influenza, Spanish flu of the late 10s that you are analyzing, and very rapid economic growth of the 20s in the 20th century, the so-called roaring 20s. And then I'm thinking also of the Spanish, no, the Asian flu of the, I think it was 1957, that was followed by the baby boom generation. In Italy, there was a major economic miracle after from 1958 onwards. So is there any relation? Because usually when we look at causes of like the economic boom of the 20s, they never mention the role of that pandemic. So it's pandemic. Their economic effects have been overlooked in many respects, at least in terms of boosting the economies, of starting a new era. So do you think this is the case? It can be generalized? And then another little question I want to make. I think the distinctive characteristic of the Spanish, or I heard that it was called by the Spaniards, it was called the Naples soldier. I'm originally from Naples, and so it was interesting for me. The Naples soldier influenza. So I think the distinctive characteristic of that pandemic is the fact that it was followed the First World War. So there is a kind of multiplier effect of two disasters, like a world war and then a pandemic, and then perhaps also this kind of economic potential in terms of subsequent economic growth period. The fact that the 20s saw that kind of economic prosperity in many respects. Thanks.
Yeah, this is an interesting question, and thank you for raising that. First of all, you're right to point out that when people talk about the roaring 20s, they talk about the post-war boom. They don't talk about the post-pandemic boom, right? And that's just because people ignore the pandemic. There's a large ignorance about the pandemic, which is incredibly surprising. And if you ask 2 years ago, and I teach a course on disasters, I taught about the 1918 pandemic for years in my course, and typically I ask people, do you know what is the highest mortality disaster in the 20th century? Or do you know what's the biggest pandemic? I ask my students. Nobody ever knows anything about, or at least until 15 months ago, nobody knew anything about that event. Okay, so people know about the wars, know about, I don't know, things they've experienced during their lifetime, maybe some other very big disasters, but they don't know anything. They didn't know anything about this pandemic. So it was something that was ignored. Now, more specifically about the question of the boom, okay? So there is this view that, the roaring 20s, some of it was this, people saw so much death in the, period between 1914 and 1920 that they just wanted to have fun. And it's called the roaring 20s, not necessarily because the economies were roaring, but because, there was a lot of partying going on. in Europe, in the US, in a lot of places, right? That's they also call it the jazz era. And so that might be one thing, okay? Because you remember a lot of countries experienced actually very deep depressions during the 1920s, right? This is also the hyperinflations that you see in Central Europe and in Germany in the early 20s and so on. Typically after a disaster, you expect a boom because there's so much destruction, so that the boom is caused by the spending on rebuilding. But that's not true in pandemics, right? So you see a boom after a war because you have to rebuild all the stuff that was destroyed, right? So the boom in the 1950s in the UK or in other countries in Europe, a lot of it has to do with, you know, spending money on reconstruction. That's not the case in pandemics. So it's less clear to me that you can directly expect that the post-pandemic situation will involve a boom. Okay, there's no evidence on it, so I don't know what the answer is. Is there such a thing as a post-pandemic boom? I haven't seen any evidence for it, and I need to, you know, I'm not sure I see the persuasive explanation of why you should expect one, other than people want to have a party, but then people party, they don't necessarily go to work. So I don't know. Yeah, I don't know if this answered your question, but that's at least my.
Thank you for the answer. Thanks.
Okay, thank you, Hugo. Other questions? Otherwise, I also have another question. So I have another point about the interpretation of the results, and especially about you show that you had some differences between direct and indirect effects, especially when you have NPI and also in relation to the coverage of the communication, let's say, or media, difference between media and institutional. If I'm not wrong, in the tables you show just the role of the action put by the media, and you show a sort of difference between, if I remember well, there is a difference in the significance of the coefficients for indirect effects in the role of the media, but you don't find in the institutional ones or something like that. So this is in some sense it is interesting because you cannot recognize a sort of spillover effect between prefectures. So this is something that is interesting, but in somehow probably there is a relation with, yeah, this is, no, it's not this one. So probably it's the next to the other slides, the next one, I think.
Okay, so this one is the one, but
yeah.
Yeah.
You were not that sure, even in the conclusion.
Yeah.
So
I just want to focus on this slide because I'm not terribly comfortable with this distinction between the different types of NPIs. So we've had long discussions among the co-authors on this, and how precisely are we identifying the different NPIs. I think I'm more comfortable with this, just identifying NPIs in general.
Okay, now I was thinking about what you mentioned at the very beginning, that, and you also show a table where you have difference, I think in the descriptive statistics, especially when you show the dummies for institutional and media coverage, and it seems that the media cover a little bit more about, with respect to the institutional coverage. Yeah, if policy, if official and media, I looking at the mean, it seems that the media cover a bit more this issue, in the sense that it's also reasonable because media, when you have the news, so you put a sort of light in the coverage.
It's easier to do that.
But I was very interested in the indirect effect, because in some sense there was a sort of not relation. Okay, was the table that you are not that comfortable.
Yeah.
Okay, I was wondering if there is a link with the sort of policy actions made at the prefecture level. So I think one of the part of the story is that the answer to the pandemic is not the national ones, as we made, especially in Italy. So the answer is national, but then we have the, how to say, the management of the pandemic, especially for health policies and for health actions, is made at the regional level. So there is these differences. But if the action in that case was also made at the prefecture level, probably you can recognize this sort of weird effect. So because probably there was prefecture that did not afford the pandemic, not in the proper way, but in how I would say in not that perfect way. Somehow I don't know how to say it, but probably there is some difference that you can recognize in these results, looking at the differences of coverage of the policy actions at the prefecture level. So I don't know, probably something that I have in my mind, but you can.
So, the only information we have is whether they did these notification policies, right? That comes out of a project that the Japanese government did in 1922 or something like that, where they collected, information about what each prefecture did. Okay, that's the source for our data. Whether there are more that local governments did other than those notification policies, we don't really know.
Okay.
Part of the problem is that a lot of the archives in Japan didn't survive.
Yeah, I got the point.
The Second World War, a lot was destroyed, as you well know. So, the newspapers, a lot of newspapers, this was a country that had a lot of newspapers in the 1920s. But a lot of those archives were destroyed during the war, during the Second World War. So we have very selective evidence from the archives that survived. So we can't really construct exposed now information about other kinds of policies that prefectures did, which would have been useful because, possibly they've done some more things other than just these notifications, but we don't.
Okay, got the point now. Thanks a lot. So, other questions? Otherwise, I think we can stop here, and thanks again, Ilan, thank you for being for us and for this great presentation, and especially for being so late with us, because I know that now is even much more late than before. So thanks a lot, and we I really appreciate your presentation. And I hope when Countess will be again free to move, and then we are free to move to see somewhere in some places or even in Italy, I think I will be happy if you can come personally in L'Aquila and see here.
I will be very happy to come to L'Aquila. Once this is, for us, it's still the borders are closed. It's difficult. It's not so much difficult to live. It's difficult to come back.
Yeah.
We have right now, I think it's a 4-month queue to go back into the country if you're a citizen.
Okay.
So you need to wait 4 months until you get a space in the quarantine facilities.
Okay. It's too much, probably.
It's pretty brutal, yes.
Yeah. Okay, so thanks again, and thank you. Thank you also to everyone. We have the next
coming in.
Okay, yeah, thank you. The next webinar will be on the next Wednesday, and Margherita Grazioli, if I remember properly, will be the next speaker. So again, Ilan, thank you. Thanks a lot. And we keep in touch.
Thank you, Ilan. Bye.
Bye-bye.
Thank you very much.
Thank you very much.
Have a good day.
Ciao.
Ciao.